Hi, so my name's Emily Miller.
And my name's Maddie Hayes, and today we're going to be presenting about the entry-level competencies for the RN and how it relates to professionalism. So before we get started, we would just like to take a moment to acknowledge that we are gathered here today on the unceded and ancestral territory of the Mi'kmaq people.
So, entry-level competencies. What are entry-level competencies? The Nova Scotia College of Nurses, known as NSCN, defines entry-level competencies as observable abilities of a registered nurse at entry level that integrate the knowledge, skills, abilities, and judgment required to practice nursing safely and ethically. New RNs entering the field and all RNs renewing licensure in Nova Scotia must continue practicing in accordance with the 9 roles outlined by NSCN. Adopting all 9 of these roles allows the RN to provide safe, compassionate, evidence-informed, and ethical care in any practice setting. These provincial expectations are also aligned with 10 other jurisdictions to implement consistency across Canada.
So who is required to abide by entry-level competencies? All registered nurses that carry a license within Nova Scotia College of Nurses must abide by entry-level competencies. The NSCN defines an entry-level nurse to be at the point of initial registration or licensure following graduation from an approved nursing education program. Their beginning practice draws on theoretical and experiential knowledge base that has been shaped by specific experiences during their educational program. It is not expected that the new RN will perform at the same level as the more experienced RN. However, it is expected that the new RN will identify learning gaps and seek guidance when working outside of their ability. As new nurses gain experience, their proficiency in these roles will improve.
So, the 9 roles of entry-level nurses. What does the NSCN outline as entry-level competencies? So, according to the NSCN Guide to Entry-Level Competencies, new RNs must adapt to 9 roles relating to the nursing profession. Each role, we will provide a definition and give an example. For more details, you can visit the NSCN website. So, if we start with number 1, the clinician. The clinician provides safe, ethical, competent, compassionate, and evidence-informed care across the lifespan in accordance with the client's needs. An example of this would be interpreting data from the patient's assessment to inform ongoing decision-making about the patient's health status. So professional, uphold the profession's practice standards and ethics and are accountable to the public and the profession. And an example of this is demonstrates accountability, accepts responsibility, seeks assistance as necessary for decisions and actions within the legislated scope of practice. Communicator uses various styles and technologies to create and maintain professional relationships, share information, and foster therapeutic environments. An example would be engages in active listening to understand and respond to the patient's experiences, preferences, and health goals. Collaborator. The collaborator plays an important role in working with the interdisciplinary health team. An example is initiating collaboration to support care planning for patients while in hospital or transitioning to another healthcare facility.
We have a coordinator who coordinates the point of care health service delivery with clients, the healthcare team, and other sectors to ensure safe continuity of care. An example of this would be demonstrating knowledge of the delegation process. The leader. Leaders are those who influence and inspire others to achieve optimal health outcomes. They demonstrate knowledge of the function of the healthcare system and how it impacts patients. They also provide respectful feedback to their colleagues to improve the overall development of the healthcare team. The advocate supports the client's voice and needs to achieve optimal health outcomes. Also, they support clients who cannot advocate for themselves. An example of this would be they support efforts of social justice, empowering their clients to make informed decisions about their health and advocating for culturally competent care. We also have the educator. They identify learning needs of clients and apply a broad knowledge of educational strategies towards achieving optimal health outcomes. For example, they'll create a learning plan and evaluate the effectiveness of this learning plan. And finally, we have the scholar, who demonstrate lifelong commitment to excellence in practice through critical inquiry, continuous learning, application of evidence to practice, and support of research activities. An example of this would be using up-to-date research to stay informed of current care practices. These 9 roles will be adopted by the newly transitioned entry-level RN and will be maintained throughout their career. Student nurses can begin to identify with these roles throughout their education, but when entering practice, they are expected to utilize them simultaneously.
So how do entry-level competencies relate to professionalism and forming professional identity? Professional identity begins to form when a nursing student starts their formal education. This formation continues as new nurses enter practice and gain experience. The entry-level competencies outline roles that will be fulfilled by new and experienced nurses. Some of the interventions to achieve professional identity formation mentioned in Giddens' Concept for Nursing Process are applicable to the NSCN entry-level roles. For example, student nurses understand their own responsibilities for learning and are accountable for them. New nurses will accomplish this through recognizing learning gaps and seeking guidance when they are working outside of already established knowledge, improving one's self-efficacy. Demonstrating this behavior, the new nurse is acting as a scholar.
So how does this topic relate to changing identities? For our presentation, we focused on the changing identities concept of professional identity formation because newly graduated nurses undergo a major change in roles as they transition from their educational programs to independent practice. New RNs will be expected to evolve in accordance with the entry-level competencies described by NSCN. Student nurses will adopt these roles throughout their education, and upon graduation will be expected to practice all of them. So let's look at some new graduates that are in practice. A qualitative study completed in Sweden at an acute care hospital interviewed a group of newly graduated nurses regarding their confidence in new roles. Due to high turnover and burnout, these nurses only had 18 months of nursing experience, but they were the most seasoned on their respective units. Despite these challenges, the nurses reported building confidence in their practice by demonstrating leadership skills and collaborating with the interdisciplinary team. These nurses also advocated when providing care for complex patients. Although the nurses reported that their working conditions limited their professional development, they were still able to increase their competence when managing a complex patient load and learned how to delegate tasks to fellow allied healthcare professionals. They reported that exercising their leadership skills allowed them to achieve a better understanding of their function as a nurse. Some of these roles outlined by NSCN were displayed throughout this article, such as leadership, collaboration, and advocacy. These roles allowed them to develop further into their nursing professional identity.
So, in summary, when entry-level nurses graduate from school, they must have a foundation of knowledge, skill, and judgment. This foundation is based on a set of entry-level competencies that licensing bodies establish to ensure that nurses can provide safe care at any stage in their careers. Entry-level competencies are comprised of overarching principles that guide newly graduated RNs, which can be used in the integration of the 9 roles that enables the entry-level RN to provide safe, competent, ethical, compassionate, and evidence-informed nursing care in any practice setting. As new graduate nurses make the transition from student nurse to practicing RN, they will experience difficulties and unknowns in practice, but it is up to the new nurse to appropriately seek guidance and apply critical thinking in those situations. As the entry-level RN gains experience, they can begin to adopt the 9 main roles that shape and contribute to the RN identity formation.